Last year, Alberta's government entered into a memorandum of understanding with the Alberta Medical Association and committed to developing a new primary care physician compensation model. Since that time, we have heard from primary care doctors about their priorities. They want a pay model that recognizes the work they do to provide comprehensive care for patients indirectly, especially complex patients with chronic illness, as the current fee-for-service model doesn't reflect this. And they, of course, wanted a market and evidence-based payment model that will ensure family doctors in Alberta are compensated extremely competitively. Our government also identified priorities, notably maintaining high panel numbers, a minimum of 500 patients, which will incentivize panel growth and improve access to primary care for patients, providing after-hours care to relieve pressure on emergency departments and urgent care centres, and enhancing team-based care to encourage the developing of integrated teams that may include family physicians, nurse practitioners, registered nurses, dietitians, pharmacists, and other health professionals to provide patients with the best care possible. So I am pleased to announce that after working closely with our partners in the Alberta Medical Association, our government has developed a new compensation model for primary care physicians that delivers on these priorities.
This is going to do a lot, not only to sustain and keep our family physicians that are here already, but will be attractive for people to come from other provinces and attractive for our learners to really think about doing comprehensive care. This new model is going to mean that the work you do behind the scenes as a physician, where you're, filling out forms for patients, talking to specialists, trying to get drug approvals, all of that is going to be compensated. That in itself, also there's going to be compensation when you're supervising, for instance, other medical team members. So this model doesn't pay for team members, but it reimburses the physician for doing all the sorts of things that a patient needs. That in itself may allow our physicians to take on more patients. So I think this is it's true benefit for Albertans, and I think it is going to go a long ways to making family medicine the foundation of our system.